Now, a question from John. More people have died from opioids than from COVID-19 in British Columbia. What are you doing about it? That's an open-ended question.
It sure is. We've done more. Listen, we have done, this is one area that I can say, I came into politics to do more for people who use substances. I came into politics because the former Harper Conservatives were not just dumb on substance use, they were cruel on substance use. And cruel to substance users. And, to restore harm reduction to Canada's drug strategy has been, I think, pivotally important to people who use substances. And in fact, we were seeing opioid deaths go down in Vancouver in particular, but all across BC just before the pandemic. So it's particularly heartbreaking to see those numbers go up again. And we know why. People are isolated. They're using substances alone. They're having a harder time finding, street drugs because of disruptions at the border and all kinds of other reasons. But, we've done more than I would have thought was humanly possible. I mean, we legalized cannabis. I know it's not the same thing, but that is a brave thing to do and a strong statement about the use of substances and it being a personal choice. Safer supply programs in Vancouver, 2 of them that allow for people who use opioids to get prescription opioids instead of seeking toxic street drugs. Safer consumption sites, funding for programs at street level that are working with substance users that are trying to provide supports. Here's where I think, the province and I think the municipality of Vancouver is interested in going, and that's decriminalizing small amounts of substances. I've been working really closely with Mayor Stewart and just recently talked to the new Minister of Mental Health and Addictions, Minister Malcolmson, who was my critic as Status of Women, so I know her really well. She's lovely. Yes. And I think, I think that we've got these requests in, and I think that, we're working through these requests with the province, with the city. And I'll just say this, I've always said that we should be there to provide the tools and the resources that the community says they need. So that's why it's kind of an exciting time in drug policy, because I think there's some potential there to work with the city of Vancouver and with the province of BC to figure out what exactly that might look like and what, and how it might be implemented if that's the choice that the communities and the province want to pursue. And finally, I'll say this, it's not the silver bullet. And I think every leader in BC knows that. I think, we have to do way more for sort of the quote unquote middle class. I think I call them the hidden opioid overdoses. And these are, primarily men, 25 to 45-ish. They're often employed, and they're often employed in the trades. And I actually have started a process working with tradespeople to dig in deeper to how we actually reach these fully employed guys who would never go to a safe consumption site, who would never likely even tell anyone they were problematic substance users. And we need to do a better job with those folks because, in fact, the numbers show that they are largely the ones dying of opioid overdose, even in BC. So we're working on the street engaged folks, working with better supports, more compassionate care, more access to supports that meet their needs. But I think we also have to work on the folks that, aren't what we would typically see as people overdosing on opioids.
I think when we first came in and the Minister of Health actually allowed for safe injection sites across the country. If you remember, the Harper government had stopped it. Put a kibosh on the
Supreme Court. Took it to the Supreme Court. Stopped the Naomi trial, which were the predecessor of Safer Supply. It was just ideological and it was cruel. And I have a lot to say about that time because I was intimately involved in all that work. But, listen, fabulous leadership has come out of BC on drug policy. It always has. I did my thesis at the University of Victoria on municipal drug policy and spoke to people like Don McPherson and Senator Campbell and, folks that have been involved in that space for a very, very long time. I can't remember, what's the name of the drug user group that's so famous?
Vandu.
These are the people who have led the charge for more compassionate drug policy, and their legacy will never be forgotten. And, good things have happened across the country because of BC.
Well, when I was asked to do this off the side of my desk in Chrétien's cabinet, the person who really kick-started this whole idea off was the then mayor of Vancouver, Philip Owen. So we have the mayors of the city. He's the one who said, he went to Europe, he saw what they were doing, he came in, and together we started the first safe injection site.
That's
It's a
amazing.
pilot project with Julio
Congratulations.
Montana and UBC. And so it all started here. And I
Yeah.
mean, BC is at the cutting edge. And I think it is important that we got the safe injection site across the country for cities that decide they need it or towns that decide they need it.
Even
Also think it was
my
really,
town, Thunder Bay.
well,
There you
but
go,
I think
right?
it's also important that when people were dying of overdoses, that we were able to give everybody access to naloxone, which
Yeah,
could save their lives
very
immediately.
true.
Not saying you have to get a health provider to do it or somebody.
Yeah.
You've got it, you carry it in your purse, you put it in your pocket. Anything that happens, you can save a life immediately. These are really important changes that most people don't know that we did. And I want to thank you for the $6 million that you gave to British Columbia so that the drug faculty at UBC can work with the doctors of BC and the nurse practitioners of BC to give prescriptions, because most people, like that guy, that trades guy, he's going to go to his family doc or whatever and say, hey, doc, I need a prescription. Get it. Nobody else knows. He comes into the doctor. Nobody what he went to the doctor for. And so that gives that privacy and that anonymity for those middle class users. But I do think that we still have some problems with the street drug users, the ones who are using intravenous drugs, because of the fact that they need intravenous safe supply. And we know that getting intravenous safe supply is a very big problem. Crosstown Clinic is the only one that can do it, and they don't have enough doses.
I know. It's hard to come by. The drug is hard to come by. There's some interesting work on that. We could talk about drug policy all night, I think.
Yeah. But I think we need to look at what Perry Kendall and those guys are asking for a non-profit pharmaceutical that can make drugs available for intravenous drug users on the streets so that they can get it without having to look for us finding diacetylmorphine and hydromorphone from Switzerland, which can only, I gather, give us 200 doses at a time. So, it's really time that we started to get a safe supply moving for everybody. That combined with the stigma of criminalization for simple use and all of those things pulling together are all the pieces that you need to do to deal with this issue, as opposed to saying, let's find one thing we can do that'll be a silver bullet. And at the end, I know you are going to say it, substance use disorders and substance use is a health problem and not a criminal problem. It's a health problem.
Well, and let's be honest, the majority of Canadians use substances, whether it's alcohol or other substances, whether it's, nicotine or other substances. We've really stigmatized certain substances and allowed a free rein on others that are, if not equally harmful, in some cases more harmful. And I'm talking about you, alcohol. It's a killer, and it is also so widely accepted and promoted. And so I'm proud to be part of a government that is having a more comprehensive and compassionate conversation about substance use and, really understanding that people who are using substances problematically, what they need, you're right, is healthcare, and they need dignity, and they need support to live in their communities free of stigma. And the more that we can actually do that, I think the more chance that a person has to actually live a healthier life, to live a safer life. And obviously cities are safer as a result. So it is good for the city too,
And my friend, the great Julio Montana, that I think is a personal hero of mine, what he always says is if we look at substance use disorders as a chronic problem, in the same way we look at diabetes and we look at all kinds of other things as chronic problems, let's allow for people to live the best possible life they can with that health problem.
That's exactly, I love that. I love, listen, when someone has diabetes, we don't write them off, even when they don't take care of their diabetes. I think about this all the time. There are a lot of diabetics that are not following the health advice that they get, whether it's on nutrition or exercise. Some people even neglect to, monitor their own blood sugar levels. But we don't throw them in jail, and we don't tell them that they're bad people. We continue to help them. We continue to support them through our healthcare system, and we continue to love them.